If you're trying to conceive and feeling overwhelmed with fertility advice, then this podcast is for you. Welcome to Don't Tell Me to Relax, your fertility podcast and antidote to unhelpful fertility information. I'm Hannah, a fertility acupuncturist, teacher and campaigner for better fertility education. This podcast aims to empower and inform you about your menstrual cycle and fertility. It's basically all that information you didn't get in sex ed at school, with the aim of improving your understanding of your reproductive health and optimizing your fertility. Hi everyone, this week I am joined by lovely Jessica, who many of you will know from Instagram, who is the fertility detective. And I always like Jessica on Instagram because I'm always admiring your green shelves in the background, which I can see today. I'm always like, that is a really nice background. It's a really nice colour green. So it's lovely to have you here with us today. We are going to be talking all about your work, and we're going to be talking about this idea of fertility investigations. But before we dig into all of that, do you want to introduce yourself, tell us a little bit about your background, and tell us what colour green shade your shells are?
Of course. Thank you so much, Hannah, for having me. Apologies in advance for my voice. I'm just recovering from a cold, that time of year, shift in seasons. And the green shelves are down to my mother and my daughter, who are the creative ones in the family. I take absolutely no credit for it. I would be hopeless at that kind of thing. And as for the shade, I've no clue. But I'll check back in with you on that. But yeah, I suppose I have actually had comments that people sort of get used to seeing you in a certain way. And as for who I am and what I do, so yes, as you said at the start, I'm the fertility detective, so named because it just was a bit of a mouthful to get into describing my background with primary degree in law, doing acupuncture, doing nutrition, doing clinical medicine. It just seemed easier to describe what it is that I actually do, which is just to get to the core of what's stopping someone from getting pregnant or staying pregnant. And I've been doing that for the last 18 years. So it's incredibly rewarding work. Yes, at times, obviously, it can be emotive or it can be tough to see what people go through. But you have to remember that, of course, like, you know, yourself, I see what happens on the other side of it. And there's few things, I think, more satisfying in life to helping someone achieve that goal.
Yeah, absolutely. And I didn't realise you were an acupuncturist as well.
Yes,
Do you
I
still
am.
do you
Yeah.
still practice in acupuncture then, or
No,
do
I
you?
stopped during COVID, actually.
Okay,
It just became, it was a difficult decision, but it was just the balancing out between the consulting work. And I was thinking to myself, well, there's actually a lot of great acupuncturists that I knew I could refer to.
yeah.
Um, there weren't as many, you know, who were doing what I did in terms of giving people very in-depth level of analysis of the case.
So let's start there then. So can you explain to us a little bit about this idea of investigating fertility sort of further, because it is something that comes up a lot, and it's something that different people have different opinions on. So tell us from your perspective, what do you mean by kind of digging a bit deeper, fertility investigations, that kind of thing?
Sure. So I think where the problems begin for most of us is the lack of education. Lack of education, lack of awareness. It's actually so bad. I mean, if you didn't laugh, you'd cry
Mm.
because, you know, hugely, I mean, there's big improvements, obviously, in the last probably 10 years with information online and social media. And that is what has led people to ask more questions. And it's actually why I started online myself back in 2019, even though I was totally clueless about the tech side of things. Simply because I was just tiring of seeing people asking the same questions, people going through the same difficulties in terms of requesting testing, you know, being experiencing medical gaslighting, which is where someone is kind of leading you to believe that your symptoms are sort of all in your head, or there's no reason to investigate further, even if you do have concerns and you're trying to be proactive about your fertility. So certainly the education aspect is probably the first issue. And then secondly, I suppose my kind of approach to it, and the approach that I would argue should be taken for everyone, anywhere they're based, is a more individualized approach, which is sadly not something that we typically see. I understand where it's coming from, as in within the medical, this kind of standard allopathic system, you know, we tend to base everything off the research, and then we take an outcome and then apply it based on age categories. And it's all very black and white, you know, all very neat and tidy in a perfect little box. But as we all know, we aren't like that as humans. We have complexities and we have individualities that need to be accounted for. And that's why I try to explain to people, for example, if you were to take 20 people with PCOS or endometriosis or name the condition, in terms of the medical approach would be quite similar. What would happen in terms of the medications that might be prescribed, or indeed surgeries, investigations would be suggested. But if you then step back and look at the individual, you'll see that actually, even though they may have a similar diagnosis, their background, secondary health conditions, life experience, traumas, environment, medication, supplements, you name it, are all going to be very unique and
Mm.
therefore will impact how you would support that individual.
Yes. And so, in terms of investigations, let's say, for example, we always have this thing where I'm a really big fan, and I bet you are too, of kind of investigating as soon as possible. And I know
Mhm.
that is not the kind of guidelines, and I understand that, but I am, and I'm sure you are, that, like you say, being educated, being proactive, understanding your fertility even before you are ready to conceive is a really valuable thing to do. So if somebody is in that situation, then maybe they're not ready to conceive yet, but they know they want to have a family in the future. What kind of like investigations would you recommend they do?
Absolutely. And there are so many things that can be done. And I think it's really important to highlight the act of being proactive instead of sort of sitting back and being told, okay, so you have to be trying for a year. I mean, there are so many people that I would have seen over the years, particularly those who might actually be in their 20s, who were thinking ahead because they already know that there's indications of problems. So the first thing I'd say is to someone who's thinking about trying to conceive in the future or might be concerned about it, that they start from the basics. So, how is my overall health? Do I have any kind of chronic health conditions? Have I been on long term medication for anything, whether it be for an autoimmune condition? It does not have to be related to reproductive health. That's so important to remember that the human body functions as an organism, of course, as you all know. So, therefore, everything is connected. So in particular, any medications that might affect blood clotting or blood thinning, whether you're on something that would affect, like I said, immune balance or gut function, everything has to be taken into account before you're assessing sort of next steps for moving forwards. Because obviously, if you're talking about what you would do in terms of initial testing, it's usually seeing your GP for basic blood work. You might get a smear test done. You might have a scan as an initial thing to do to assess the ovarian activity, the lining thickness, just to see that there's nothing weird or unusual going on internally. And of course, if partnered with a sperm producing partner, then they would typically just get a semen analysis. But as we'll be talking about, there's a lot further that you can go in terms of testing, and often at an earlier stage than people expect, so that you can really maximize the odds of non-assisted conception, assuming that's an option available to you, rather than having to jump to fertility treatment as a first step. Obviously, I appreciate there are categories of people who would require that straight away, but
Mm.
for those who don't necessarily, I think it's really important to understand there are other options available.
And let's say, for example, somebody is trying to conceive naturally, or either, they're trying to conceive naturally and it's not happening.
Mhm.
And let's say they've had the basic test done, they've been to their GP, they've had the basic test done, they've had a sperm analysis done, and kind of a common thing that we hear a lot is everything on paper so far shows me that I'm okay. So people are then like, so what are my options next? And let's say they've been trying, let's say 9 months, 10 months, they're into the journey, and
Hmm.
they're kind of feeling a bit like, well, where do I go next?
That's hugely frustrating, actually, that aspect for people. And it's something that I know you deal with every day. I see it as well. And often, where people are falling at the first hurdle is through no fault of their own. It's not actually even necessarily due to the fault of the practitioner they're dealing with, although that's open for debate, because the reference ranges, if we actually take a step back for a second and look at, well, how is, the methodology applied in terms of the scientific research for devising what should be the ideal range for something. The problem is that the ranges are far too broad for
Mm.
most markers. And that's because they're based on the average member of the population. And not to geek out, but if anyone's interested in research, how they're analyzing is based on the bell curve. So if you have 100 people analyzed, and let's take something very commonly seen as a problem, thyroid dysfunction, and you're trying to see, well, what is the average thyroid stimulating hormone level or TSH level for a person? They will look at 100 people and find what the bulk of them fall into. Now, the problem is, if you have 100 people and like 50% of them just happen to be underactive thyroid because it's so common across the population, you're going to get skewed reference ranges. So that's just one example. There are many others of where a range will be too broad. In the case of TSH, for example, it could go anywhere from about 0.5 up to 4.5 or above. And in reality, for fertility, we kind of want it like below 2.5, like 1 to 2. So that's just one of the issues that you would see. But the same would apply across the board for nutrient levels, for cardiovascular markers, for other immune markers that just wouldn't be picked up on necessarily by someone just attending their GP.
And so, what can people do about that? How do they navigate that themselves? Because it's really frustrating, isn't it? If you're
Mm.
told everything's in range, there's no problem here. Like, how would you advise somebody to address that?
Well, if you're dealing with someone who isn't well up in this area, like if it isn't their specialization area, which of course for many GPs, hence the name general practitioners, it wouldn't be, then you need to find someone who is focused on fertility. That's really the key thing. Never be afraid to get a second, third, or indeed fourth opinion. If you don't feel that the information you're receiving is logical, sound, evidence based, that this person is on your side, that they're really listening to your case, not dictating to you, as I so often see. If you haven't found someone like that, then you need to keep looking until you do. Otherwise, you're going to cost yourself valuable time, not to mention just the emotional heartache of it all as well.
Yeah. And other than the basic tests we've talked about that people often have at their first line fertility assessments, either through their GP or often through a fertility clinic, what tests do you think are important to consider that might not necessarily be offered or might not necessarily be thought of as or important at that point in time? What do you think about other things that are out there that could be investigated?
Sure, there's so many, and really it will depend, obviously, on each individual or couple's case. But I feel like sometimes they're so close to getting the information that they need, but it's just not offered or given them, or given to them. So if you're talking about on the sperm side, the individual will be offered the semen analysis test. That's kind of the standard test offered, which just tells you how many, how well they're swimming in the shape. They rarely will be offered testing beyond that. So, for example, if the semen analysis comes back saying, oh, everything's looking good, happy days, then they're just discounted. They are swept aside and all the focus goes on the person with eggs. And that can be very problematic. Whereas if from an earlier point, and earlier will depend on the person. So if someone is, let's say, over 35, and definitely if they're over 37, trying to conceive for more than 6 months, absolutely get the sperm DNA fragmentation test. Or indeed, even if you've only just started out on your journey, but let's say the partner with sperm has a history of trauma to the testes or, history of hernia repair in the groin area. If there's anything like that, any history of benign prostatic hyperplasia, anything weird, unusual, then get that test done straight away. Because of all the things that I would deal with, and okay, it's my particular area of interest. I did my dissertation on sperm health, but I do find that it's a huge disservice that is being done to people where they're being told at an early stage of their journey, semen analysis is all good, nothing to worry about, let's carry on. And then they find themselves 2 or 3 years down the line, having already proceeded with fertility treatment. And then they're discovering, oh my goodness, all this time, the sperm might have actually been a factor, particularly because the sperm are so vulnerable and are made afresh on a daily basis. So while there's a lot of talk about aging, maternal age, the age of the ovaries, at the same time, we have to account for the fact that age also impacts the sperm and indeed what is happening on a daily basis. So that'll be one on the sperm side. On the side of the person with the eggs, there would be common things that I would see. So, for example, I actually had a couple of clients a few weeks ago who were telling me their story. They've been trying to conceive a few years, and she was telling me about her outcome with IVF. And I sort of stepped back and I paused for a second and I said, well, hang on, at what juncture did they check your tubes? I mean, obviously, I assume they checked your tubes. Never make assumptions. She looked at me and said, well, now that you say it, they tried, but it was a bit shady and they couldn't really get in, but they said it doesn't matter because you're doing IVF anyway.
Mm.
And that to me was shocking. I mean, honestly, going back to my legal background, that really is like medical negligence because, it wasn't for that particular clinic to make that decision for those people or to take away their right to have all options of conception open to them. Because I said to her, well, as far as I'm concerned, if you haven't checked your tubes, we don't know. We don't know if there was actually a chance of non-assisted conception happening here, because you were essentially deprived of that information. So that's a very common one that I'd see. Also having proper scanning done of the internal environment. It's minimally invasive. Yes, it is transvaginal. So for anyone with vaginismus or vulvodynia, they would have to have a conversation first with the sonographer before proceeding. But certainly, there's no pain involved. There's no anesthesia. And it's a very helpful way of assessing the thickness of your lining, which, remember, ovulation predictor kits can't tell you. They're highly unreliable at the best of times. And it can tell you the ovarian activity, give you any clues as to whether you might be on the spectrum for PCOS or not, or whether you might have, diminished ovarian reserve. The way the ovaries are behaving is maybe a little bit quieter than you'd like. So that can be a really good starting point. And again, I often don't see scanning happening until someone has already started onto medications.
So do you think then that if there were more investigations into fertility on both sides, that fewer people would need to go down the road of IVF or assisted conception?
There's simply no question. There's no question that would be the case. I mean, that's like saying it's akin to, if people drank less, there'd be less people in A&E at the weekend, or, less cost to the economy that way. Of course, if we front loaded more, if we approach the problem more proactively, rather than, implementing all of these, which I understand they're necessary guidelines, if you've been trying over a year, if you're under 35, or trying 6 months of over 35, but it's too generic. We're not like that. We're not all black and white, simplified down to being like robotic in our body's way of behaving. I've dealt with people in their 20s who are extremely stressed about their fertility, but they are being actively dismissed because they're being told, you're still young, you have time. And I remember one couple before, she was 28 years old. She'd been actively trying to conceive for over 3 years. And my feeling about that is, well, if we're talking about, you can't have it both ways. If you're talking about age being a causal factor for fertility problems, and as in the older you get, the bigger the problem, well, then we can't ignore those who are young and who are struggling. Surely they are more of a concern, not less. So I feel like there is a bit of a strange, juxtaposition in how there is one approach when it suits them and then another approach when it doesn't. And I think people should be very mindful of advocating for themselves and just not taking it at face value, not accepting something if it doesn't feel right.
And why do you think we have ended up in this situation? Like, why has this kind of, I always talk of it as like this gray area, because it feels like there is either a GP assessment and intervention, which is very, very minimal, and unless they have an understanding in fertility, might even be incorrect. I mean, the number of people we have seen in clinic who've had the wrong test done at the wrong time, they've been refused tests. So there's that side of that sort of thin end of the spectrum. And then there's the other, which is kind of like fertility units, and often it's private, because I don't know what it's like over there, but over here, people's ability to access it publicly funded is becoming increasingly difficult. So often there's private fertility clinics who often, they're fertility clinics, so their job is to kind of do IVF. So there's this whole range in the middle where it seems like this idea of investigating, treating the root cause, finding the root cause, sort of working on health and fertility before you get to that point is kind of lost. And I don't know how we've ended up in this situation.
Yeah, everyone falling through the cracks.
Yeah.
I think it's because when you look at it, I mean, a fertility treatment itself, as in IVF, is only 45 years old. So that's nothing. And I mean, I've been at this for 18 years. I think you're a good length of time as well, the same. So, we've seen the shifts and the changes during that time frame. The introduction of genetic testing of embryos, the changes involving, freezing, which is much better now than it had been at the start. We're still, honestly, pardon the pun, but in the infancy stages of the development of fertility treatments and the understanding. And when you consider that was also running parallel to, the 70s, 80s, 90s, where, I mean, gosh, I remember so clearly in my childhood how this kind of thing was talked about. It wasn't. So you've got cultural and religious layers of problems on top of that as well, where anything to do with fertility involves discussing sex. Oh no, let's not do that. It's shrouded in shame, taboo, so much embarrassment for people, as you can well imagine, because obviously with my focus on sperm health, when I'm talking to fellas about their sperm, they're often a little bit uncomfortable having these discussions. And it's just because we weren't brought up that way. We didn't have great education in the schools in terms of how sex education happened. It's definitely improving now. But essentially, we were, for the generation in their 40s now, as I am, were brought up being taught, just stay away from anyone with sperm or you'll get pregnant. And that was it. So that was, there was no extra discussion really as older teenagers and in college. It was, how to use condoms, make sure there's condoms available. I mean, when there's so little education about it, it's no wonder that then filters over into the actual level of care that people receive. And you hit the nail on the head when you said about the fertility clinics aren't really fertility clinics, they're IVF clinics. Because I had that discussion with a very good gynecologist based here in Ireland. And he used those words. He said to me, Jessica, it is eternally frustrating to me because this particular surgeon is really an artist in what he does. And he really specializes on the anatomy, the internal environment, making sure it's clear of all adhesions or problems. And he said the amount of people, he said, that I could have saved from fertility treatment, from having to go for IVF. And he said, that's the point. He said, the clinics aren't actually improving your fertility potential. They're just offering you tools and technologies, which are great, to kind of bypass things, but without really getting to the root cause of what's going on, which of course is the problem.
And so if somebody is thinking about, say this, maybe somebody listening to this podcast at the moment and they're contemplating going for IVF and they feel like they're not quite sure what they should do. They feel like they're not getting anywhere. Nothing's come up. I tell you a very common situation, which I'm sure lots of people who are probably listening to this are in, is that they maybe have been told they've got unexplained infertility. So what would you say to them in terms of their next step? So they're thinking about IVF. They've had a level of investigations done. They've got this definition. Like, where do people go with that? Is IVF the right approach?
For most cases I've seen, no, it's not. And in fact, it's interesting that you said that because I had a couple about a month ago, a month and a half, and she said that exact thing to me. She said, I was in this clinic, Jessica, and they just finished discussing, going through all our test results and everything, telling us how everything's fine, everything's fine. So their suggestion was IVF. And my response was, but hang on a second, how can you suggest IVF to me when you don't know what the problem is? What are we doing here? And the reality is, like I said, it goes back to what I was saying earlier on. Either testing has been misinterpreted that had been carried out, or markers were completely overlooked, whether in blood testing or checking the internal environment or the sperm, whatever it might be, that should have been carried out. So frankly, unexplained infertility is not an acceptable diagnosis. We don't accept that diagnosis in any other aspect of medicine. You don't have unexplained heart conditions where they just let you waltz off and best of luck to you. They don't do that. So therefore, it is just lazy medicine. We have to do better. And if someone has been told, if anyone listening has been told they have unexplained infertility, again, I would recommend finding someone who specializes in this, who can give you the time to actually delve deeper into your case and figure it out. Often you don't even have to dig that deeply from some of the cases I've seen, because the answers are staring me in the face. When I go through someone's case, I can see what hasn't been tested, what has been tested but was misinterpreted. And once you just have someone to tie the threads together for you, then it all starts to make sense. And that's not to say that there aren't valid cases where, if you're talking about unexplained infertility, I have seen complex cases over the years where, there might have been previously unknown anatomical issues such as uterine anomalies, where a person might have deviation in the septum of the uterus, or only half of a uterus, a unicorn uterus. There can be all sorts of things that you just might not discover until later in the game. But nonetheless, to say to someone that they're unexplained, if we look at the definition of it, I think this is the problem about it. The definition of unexplained infertility is over a year trying, proof of ovulation, proof that the tubes are open, and a semen analysis. But what's missing from that equation? It hasn't done a sperm DNA fragmentation check to check the quality of the sperm. So it doesn't matter how many there are and how well they're swimming if they're not carrying good DNA. it hasn't assessed the internal environment properly, because just because the tubes are open doesn't mean there might not be silent endometriosis present internally around the ovaries, which could affect the egg quality or affect inflammatory markers that would therefore have a knock-on effect on implantation. So ultimately, the definition is flawed. So that's really the problem. And that's why so many people are left with this diagnosis and not knowing what to do next.
And the thing is that if you say you have like further investigations done, because is it that you had further investigations, you do find something? I guess what happens then is that you can address it before, because people might end up going for IVF anyway. But I guess what you're doing is addressing an underlying issue, which might then help improve their chances when they do go for IVF.
Yeah, which is hugely important, because I would always respect the time factor. I mean, most people who would attend me, because I deal with pretty complex cases, they've usually been trying for a while.
Mm.
So I'm always having to weigh up the pros and cons, and, give them the best advice that I can so they can make an informed decision on next steps based on their criteria, based on the age of that couple or individual, so that they're not going to be wasting time. Because the other thing we have to remember too is that fertility treatment is an expensive process, even
Mm.
if you have access to, a publicly funded system. Nonetheless, it doesn't come with the bells and whistles. It's never going to have any additional testing included with that, which in itself can be a problem, because then people are having things overlooked. And so when you think that, most people will be told by a fertility clinic that the average it takes in order to have a take-home baby is a few cycles, and not just a few cycles, but every embryo created from any of those cycles has been transferred. That's a lot. That's a
Mm.
lot of investment. So it makes far more sense to be able to prepare properly for any form of fertility treatment, whether it be IVF or ICSI or donor egg, donor sperm, whatever it might be, to prepare for it properly such that you're most likely to get a good outcome, because nobody wants to be attending a fertility clinic for years on end. It's awful.
Yeah. And so if people want to get support, say there's someone listening to this and they want to get further support to investigate
Mm.
their fertility, they feel like things have not enough digging has been done. Where would you suggest people go?
Well, it'd be people like myself or yourself, frankly. I mean, if you've done everything you can with your GP, we're like what bridges the gap, okay? So, of course, people should go see their primary care physician, see their GP, get their general testing done. But if they're starting to draw a blank, if they've been trying over 6 months and their GP is just shrugging their shoulders saying, I can't help you, go to a fertility clinic, it's at that juncture that you really need to step in. And when I say that you need to step in for yourself. No one is going to advocate it for you, sadly. The system isn't going to catch you. You're going to have to be the one to stand up and say, okay, this is not working and we need to do something else before we go down that path. And then that's where someone like us would come into the mix, where we can actually go through your case in detail, figure out what needs to be assessed, and then refer you appropriately. Because, of course, that's what I'm doing. I'm sending people to the best surgeons for gynae stuff, or urologist, or the best clinic for their needs, which might be in Ireland, the UK, Spain, Greece, Prague. Across the board, it will depend on what that individual or couple needs. So really getting bespoke care is the most logical step to take if you want to get good results.
Yes, and I think that idea of kind of having to advocate for yourself and inform yourself and sort of make the decisions yourself is one of the biggest takeaways that I always come away with whenever I have a conversation with someone about fertility, because there are always so many different options, so many different opinions. And like you say, fertility medicine is really in its infancy. So
Mhm.
the amount of you know scientific evidence to say this is definitely the way forward, it's not really there, is it? It isn't robust enough, the science, to for there to be one clear, concise way for everybody. So I think that idea of investigating for yourself and advocating is always the biggest take home message.
Completely. And there never could be one path for everyone. It just would be biologically implausible, because you just reminded me there of a conversation I had with a client earlier in the week. And she had her mind set on a particular clinic, which will remain nameless, in Spain. And the more she was talking, we are going through her results and what she was looking for herself and her partner, and in terms of how many embryos they wanted, etc. So the more she was talking, I said, I don't think this clinic is going to work for you. And I suggested another clinic to her. She subsequently contacted them, and then I just received a flurry of emails afterwards where she was saying, "Oh my God, Jessica, yes, they do this. And yes, they will genetically test after each embryo rather than batch testing at the end. And yes, it's like half or a third of the cost of the other clinic." And so she was thrilled because she suddenly realized, oh, there's actually this other option for me. But the point is that when you're so caught up in it, when you're, you can't see the wood for the trees. How can you? Because you're too close to it. It's too emotive. And you need obviously someone to be able to help you to take a step back and an overview of your case so that you can actually make progress. Because otherwise, what I've seen so often happening for people, and I've actually received emails from people saying, "Oh yes, I've done this," is where you end up essentially with analysis paralysis, where you're so overwhelmed with your kind of window shopping for different clinics and different consultants, and reading on forums online, which I know can be very helpful, but they can also be a downside as well, because you've so much information coming at you from different angles that you don't know where to turn and you don't know what to do next, so then you end up doing nothing. And that's always sad when I see those people who email me saying, "Right, yeah, I was thinking of contacting you 2 years ago, but here I am today." And that's heartbreaking. So I'd encourage anyone listening to please take some form of action. It might not turn out to necessarily be the right one, but if your gut instinct is telling you that, to the best of your knowledge, this does feel like the appropriate step to take, then please do take it rather than being stuck in inertia.
Yeah, that's really, really good advice. And so, Jessica, just before we finish off, if somebody is going into thinking about fertility treatment, so we're sort of focusing quite a lot on IVF in this series of the podcast, what would you advise they think about before they go into it?
As in for their first appointment.
Yeah, let's say for their first appointment, they've never done it before. What would be your sort of top tips for somebody before they went into that IVF appointment, or, before they went into that round?
Hugely important question. And of course, everyone can speak with the benefit of hindsight, once they've been through it. But the most common things I hear from people is, "I wish I hadn't rushed into it."
Mm,
I would highly recommend that you do not sign any piece of paper when you go in for that initial meeting. Any decent clinic shouldn't be encouraging you to sign on the dotted line at the first appointment, but in case they do, or you have this lovely meeting with a consultant and then you're ushered into the room with accounts, that's where you say, "No, thank you. We will take all this wonderful information home with us and we will get back to you." Just be very, very careful, because as anyone who's been through it will tell you, you're usually signing more than 20 plus pages of documentation. And when you read the small print, it can be quite interesting what you are actually signing away in terms of your rights. So you just need to be very cautious with that. I know that's the lawyer in me, but just do be very careful. Then when it comes to actually sitting down and going through everything in your case, it's not so much the specifics. People often focus on, well, what are the success rates for this particular
mm,
clinic, and they kind of get lost in the glossy marketing that might be pitched to them. But that's just marketing. Now, we know it works. They wouldn't have spent millions around the world in marketing and advertising if it didn't work. But just try not to be seduced by it. Try to sit back and really consider, how is this consultant or clinic dealing with me? How are they approaching me? Do I feel like they're actually listening to me, or is this person speaking over me and just determined to sort of lay out how they do things and what their protocol is? Because you don't want that. You don't want something that is generic and just, a cookie cutter approach to what is actually a very nuanced thing. And then the other things I would say is, obviously they're a bedside manner, as it were. How are you being treated? Are you actually being treated with compassion, like you're people, or are you just another number on a chart?
mm,
Because that'll get old very quick. You will not be happy going through the process if it's like that. And the other thing too, which I'd say to keep a close eye on, is the logistics of the thing. I have had people describe to me how they were, greeted with sort of all the fanfare, as it were, when they initially signed up with the clinic. But then once they'd signed on the dotted line and were in the system, goodness, they couldn't get a doctor on the phone, or if they had a query about their protocol. And that's actually, more tiring and devastating for people than the rigors of just going through an IVF cycle itself. So just be very conscious of all those things. And of course, speak to people who might have attended them before. It doesn't have to be friends or family. You can, of course, speak to people online. I think that's where it can be helpful, actually, some of those online forums. Never compare your protocols. That's a dangerous thing to do. But just, how was this doctor to deal with, or this clinic, can be a helpful starting point so people can start to make decisions about what they'd like to do next.
Yeah, that's really, really helpful advice and information, Jessica. Thank you so much for sharing all your experience with us. If you would like to find out more, I'm going to put all your details on the show notes, because you do online consultations. So it doesn't matter where people are, they can get in contact with you.
I've had consults with people from Alaska to Botswana.
Oh, wow.
Seriously. So it doesn't matter where you are.
Okay, well, thank you so much for your time. It's been really great to speak to you. And I really hope this episode has been helpful for everybody listening. And we look forward to seeing you again soon. Thank you.
Thank you so much, Hannah.
If you've enjoyed listening to this and want to find out more, then come and join my free community in Facebook. We have loads of resources. You can catch up on all our previous webinars and be the first to know about forthcoming events. To sign up, just follow the link in the show notes. And if you'd like to work one-to-one with myself or one of the team, then please see our website, hannahpern.com, where you can book in directly or organise a discovery call to find out how we can support your fertility and your reproductive health.